I'm going to be providing education to a 3 to 5-year-old on a bronchodilator. I'm actually going to be providing education to the parent, since the parent is going to be the one who is responsible for ensuring that this kid is taking their medicine and ensuring that none of the undesired side effects are happening. So I'm going to go ahead and start. All right, I'm just going to give you some education on the medication that your child is going home on. He is going home on albuterol, also known as Ventolin. It's a bronchodilator. So you're going to use this when your child is wheezing, if they're saying that their chest is tight, or before doing any activity that will make them breathless, like climbing stairs or playing sports. So the way that this drug works is the drug will be inhaled and it will relax and open the air passages in your child's body to make breathing easier. Side effects that you might notice that are totally normal are shakiness, headache, throat irritation, and muscle aches. Some considerations that us nurses watch for a lot that you can also watch for is you want to monitor their respiratory rate before and after administration. Basically, you just want to make sure that the drug did what it's supposed to do. So before, if you notice that your child is wheezing or coughing and you administer that drug, afterwards, you just want to make sure that that has gone away or it has gotten better, because the drug will work pretty quickly. So you just, after they take their inhaler, maybe wait a minute or two and make sure that the drug worked. Also, since your child is so young, since he's 3 years old, I would suggest to use a spacer to help breathe in the medication more easily. So basically, we're just going to send you home with this spacer. You put the inhaler into the spacer, and then it'll just hold the drug in it so that your child will intake all of the drug instead of maybe wasting some. If they're just using the inhaler, sometimes they don't get all of the medication. And then lastly, you just want to have your child rinse their mouth after administration, because if you don't, then that can increase the chance of oral thrush or mouth sores or something like that. So just take some water, rinse your child's mouth out, have them spit it out, and that will greatly decrease the chance of that happening. So 3 things that you want to monitor for while your child is on albuterol is a fast or rapid heart rate after administration. This is an unlikely side effect. Another thing to watch for is something called paradoxical bronchospasm, which includes worsening of wheezing, coughing, and tightness of the chest after taking the drug. And you want to ensure that your child is not taking over the prescribed dose of the inhaler to minimize complications or adverse effects of the drugs. If any of these things do occur, be sure to let your doctor know. And then lastly, I just want to educate you kind of where your child is likely at since they're 3 years old. So they're in this stage of development called autonomy versus shame and doubt. And in this stage, your child is learning to be self-sufficient in ways such as self-regulation, toileting, feeding, and dressing. So they're likely going to be excited to kind of take responsibility over giving themselves this medication. And so I would just encourage you to encourage them to let them know when they are feeling this tightness or wheezing, and just kind of let them have control and let them know, like, hey, if you're having tightness of chest, if you're coughing or wheezing, like, let me know, because then they'll feel like more in control of their medication regimen. So yeah, let me know if you have any questions.